Good day, Dr. Campbell and fellow colleagues. This is the Chenette group, and it consists of Shanika Antwine, Anissa Ogis, Cheyenne Clark, Shakila Clark, Jamie Dessin, Shania Dorset, and Alicia Stout. A cataract is a thick, hazy region that develops in the eye's lens. When proteins in the eye clump together, the lens is unable to transmit clear images to the retina, which is the beginning of a cataract. The retina functions by turning the light that enters through the lens into signals. It transmits the impulses to the optic nerve, which then sends them to the brain. When it finally affects your vision, it progressively progresses. Despite not typically developing at the same time as wrinkles or aging, cataracts are frequent in older persons. In this slide, you will be seeing a picture, an example of a cataract. You'll see there's a picture of a normal eye, and then there's a picture of a cataract eye.
Causes of the ailments. Most cataracts arise from alteration in the tissue that makes up the eye lens brought on by aging or injury. The risk of cataracts may be increased by inherited genetic conditions that result in other health issues. Other eye disorders, previous eye surgery, and other conditions include diabetes might also contribute to cataract development. Can also form with some steroid drug use. Other reasons you might get cataracts are smoking, having had an eye injury, eye surgery, or radiation treatments on your upper body, having spent the time in the sun without sunglasses, use of as corticosteroids, which may cause the early formation of cataracts. Next slide. In this slide, you see an image of cataracts and an image of cataracts caused by old.
Symptoms associated with the ailment: foggy or fuzzy eyesight, or your vision becomes clouded, blurred or dim, color appears faded, nighttime lighting, sunlight, and headlights seems overly bright, making it difficult to see. Lights have halos surrounding them. The three images show symptoms associated with the ailment to have a better understanding.
Surgical intervention that is commonly utilized during treatment, one of which is called a small incision surgery, also known as phacoemulsification. Phacoemulsification is used to restore vision in people with cataracts or clouding of the eye's lens. To begin the procedure, the affected lens is exposed from within its surrounding cavity. High-frequency sound waves released by a handheld ultrasound device. The lens is then broken up into emulsified cutaneous mass. The mass is then cleansed with sterile fluid and suctioned out the eye with a vacuum. The procedure is completed by replacing the damaged lens with an artificial one. Some types of lenses available include fixed focus monofocal. This type of lens is mainly to focus strength for distant vision. Accommodating focus monofocal. This lens can shift focus to near or distant objects and respond to eye muscle movements. Multifocal. These lenses have different areas with different focusing strengths, which allow for near, far, and medium vision. Astigmatism correction or toric lens is specifically to help correct the vision of persons with astigmatism. Within a few hours after surgery, the patient should notice colors are brighter as a result of the removal of the cloudy lens. For the first days after surgery, the patient may experience blurry vision and eyes can be light sensitive. Dryness, itching, burning, or red eyes are some common side effects that may last a couple of days. Eye drops or medication is given to prevent or control inflammation, infection, or high pressure of the eye. Before going to bed, an eye shield is sometimes recommended to protect the recovering eye. Follow-ups are recommended by your ophthalmologist until the eye is completely healed, which usually lasts within 8 weeks. In most cases, glasses are needed after cataract surgery. The doctor will inform you when your eye is healed enough to get a final prescription for eyeglasses. These pictures show an image of a lens with cataract before surgery and the difference after surgery.
Pharmacologic interventions for mydriasis in cataract surgery. Achieving the proper intraoperative mydriasis is one of the key elements involved in the safety and effectiveness of the procedure. During cataract surgery, inadequate pupillary dilation of constriction of the pupil can limit the surgeon's field of vision and make it challenging to control equipment. The aim of the study was to document and compare the risk of intraoperative and postoperative complications following phacoemulsification for cataract extraction. It also aimed to examine the cost-effectiveness of using 3 different methods of pupillary dilation, including topical, intracameral, and depot delivery systems. The World Health Organization International Clinical Trials Registry Platform for Clinical Trials, Medline, Ovid, and the Cochrane Central Register of Control Trials. They only considered randomized control trials in which patients had their cataracts removed by phacoemulsification. Due to the statistical variability between the estimates from different studies, they were unable to obtain overall estimates of comparative effectiveness for the majority of outcomes. The certainty of the evidence for most outcomes was low or very low due to primarily to imprecisions and risk of bias. 5 RCT reported mean pupillary diameter at the end of the cataract surgery. Data for this outcome from the largest RCT provided evidence of a small difference in favor of intracameral mydriasis. Surgical times were lower when depot delivery was used, but the confidence interval estimated from one trial was consistent with no difference. Evidence from one RCT suggests that topical mydriatic may be greater in discomfort than intracameral driatic procedures for cataract surgery. Another RCT reported iris-related complications in 11 participants versus no complications in the depot delivery system group with very low certainty evidence. There are 3 approaches to achieving mydriasis for cataract surgery, but only one trial had a sample size adequate to yield a robust effect estimate. Larger, well-designed trials are needed to provide estimates of the effectiveness of these approaches for beneficial and adverse effects.
On behalf of our team, Chenette, we would like to say thank you, and we hope that our research was as intriguing and informative as it was for us to do it. Thank you.